I am so excited to welcome back to the show Dr. Katerina Gallus from Restore Plastic Surgery. How are you?
I'm good. Good. Happy Valentine's Day.
You look so pretty in pink.
Thanks.
I love it. So she's our expert, you guys. For those of you that don't know, she's board certified by the American Board of Plastic Surgery, has over a decade of experience in cosmetic breast, body surgery, facial rejuvenation, and breast reconstruction. She's always such a great resource to our viewers, so we love having her on to give you guys tips, talk about trends and what's happening in the industry. So before we kind of get started, because we're going to talk about some cool stuff today, I want you to kind of tell the viewers a little bit about Restore.
So ThePulseSD plastic surgery started in 2017 after my time served in the Navy. And it's a very boutique-y, serene place. You've been there.
It's gorgeous.
We have full medical spa services, esthetician, laser, the non-invasive treatment, and just a lovely environment in which you can, discuss what your aesthetic goals are, and in a very non-judgmental and calming environment, we can reach a plan for you. So,
and it's female run,
yes,
right?
Female veteran run, all girl office. We really embrace that, and we welcome male patients too. They actually like to come in. Everything smells nice, so.
And they have skincare. I mean, it's like everything. It's like you go in there and it's like a spa. I mean, it's a very serene environment, so I love it.
Yeah.
Okay, so we're going to talk today about some different techniques, some different procedures that don't require anesthesia. So I know a lot of people want to get stuff done, but sometimes they're scared to go under anesthesia. So you kind of opened my eyes to this. I didn't even know about this. So can you kind of talk to the viewers about some of the things that you can do? I think awake liposuction was one.
Sure. So we were going to talk about that today, and some of it, from a surgeon's perspective, I'm just used to having people under general anesthesia, and so it's a little bit of a diversion from that, and just understanding, again, what the patient wants. So my coordinator is deathly afraid of general anesthesia, and although anesthesia is very safe, she wanted her liposuction done under sedation.
Okay.
And then taking from that and really understanding, and myself, I've had general anesthesia, and it can be very nerve-wracking because you're losing control and letting somebody else put you to sleep. If you have the tolerance for it, and you're, can stay calm, and we do all those things to make you calm, a warm room, maybe some relaxing medication, then we can safely perform your procedure just like liposuction without going to sleep completely.
Wow.
The other benefit is that as I'm doing your liposuction, I can have you stand up and kind of check where we are, show you results as they're happening in real time, because a lot of times with liposuction, as the on-table result, which is often Instagrammed, immediately goes away for the first couple weeks because you swell back up. And so I've seen the on-table result, but the patient the next day is like, oh, I can barely get my garment on. So you are awake and very aware of what your result is going to be, and then I think that motivates you as a patient to wear your compression, follow the directions so you know you want that result.
Well, and I thought it was interesting because it's one of the most popular procedures, liposuction. Nearly 400,000 procedures are performed in the U.S. every year. I had no idea.
But that being said, it's not for everybody. It's not a weight loss procedure. So if you're looking to lose weight, your scale numbers might not change dramatically, and it's not a global, I just want everything taken off. It's best for people who are fit and active and have stubborn areas that they can't get rid of.
So that's the best candidate for that. Okay, that's good to know, because it's not going to be a fix-all for everyone.
No. Yes.
Although we wish it was.
Yes, that would be nice.
Okay, so there's other procedures though that can be done, right? Eyelids.
Yes, so another common procedure that I do in my office is upper eyelid blepharoplasty, which just is an upper eyelid lift.
Okay.
And it's just removing that excess skin that develops as you get older above your upper lid.
So you can't open your eyes, you're like...
Yes. And so your eyes open wider and you look more refreshed and less tired. And it's also, takes about an hour to an hour and a half. You do have a little bit of downtime with that because your eyes are going to be swollen. You're like a newborn kitten right afterwards.
Okay.
And then as the swelling goes down, usually over a weekend, these procedures are all best done on a Thursday so that you can go back to work on Monday, as long as you're not a warehouse person or,
So that's really quick. So there's really not a lot of downtime. Okay. And so what about labiaplasty, tattoo excision, right?
Yeah, so there's a multitude of other things that people don't really talk about, and it's not advertised as much as, breast augmentation and tummy tuck, which are, popular cosmetic procedures, but require anesthesia. So labiaplasty is another one that women are afraid to like reach out and talk about, but everyone's different, and people who have, excess skin down there and want it removed, that can be done in office under local anesthesia, very comfortable. And we can address problems that cause problems with, athletic activities or just chafing or clothes wearing, and it really does correct that. Other things, earlobe, those gauge earrings are less popular now. Correcting that's a surgical procedure. I've had people come in to just reduce the size of their earlobes, or the other common one, since you'll never have this, is earrings. Women, they wear heavy,
right?
Heavy earrings over time, and the earring slowly stretches out the piercing until you have this like long hole, and that is corrected surgically. So that will never be your problem.
I'll never
That's
have
the
that
upside,
problem.
yes.
But this is great that there's these opportunities. I love that.
Yeah.
And then you were saying like the bra bulge or under the chin, which I know is like popular.
Yeah, so those are also easy from the awake liposuction aspect of things. Those are easy fixes. So this is a common complaint here, the little bra roll bulge. Under the chin, submental liposuction, those are easy areas to touch up, and the recovery is pretty reasonable. Also common a little bit here. And then the arms, if you want some arm sculpting, because you've been working out and you're just not seeing that muscle under there, that's another target area.
But they need to come see you, do the consult, figure out what they're looking for, and then you can give them the best advice.
Yes, I can let you know whether that's, is gonna get you the goals you want.
Well, and I love that you guys have specials every month. You guys always have something. So let's talk about what you've got going this month.
Okay, yeah, so I printed them out so that I would not mess them up. But for Valentine's Day and for the holidays, we're doing Pick Your Passion. And so I do the full spectrum of Botox and fillers and the Diamond Glow facial, which is an amazing facial. So we have specials on those.
And it's $349 for three facials,
for three,
which is amazing.
Yes, and if you book those facials, you will get a free skincare kit from Zeo Skin Health, which we love their products. And then upcoming now is upcoming for March is a breast augmentation and a Brazilian butt lift, which we could have a whole discussion about what that is.
We should talk about that. A lot of people have asked questions about that.
About that special. I also do the non-surgical BBL, so I either use Sculptra or diluted Radiesse. Those are other products.
Right?
Yeah, because a lot of the women that come see me don't have enough fat for the BBL part. So there's a way.
Have that problem.
I know. So, and we always have people who want to donate. And then our currently favorite special is the worst Valentine's gift or story. We're running that on social media, so Facebook and Instagram.
Okay.
And it's, even though it's Valentine's Day today, at the end of every week, the person who posts the most horrific or entertaining story about their worst Valentine's Day or the worst gift they received, we pick one winner each week, and we're going to run that for the remainder of February. So there's 2 more chances to win.
That's awesome.
So follow us at ThePulseSD Plastic Surgery.
And do they win the special? What do they win?
They win a free Zeo Skin Health product.
Oh, and you guys they have the best skincare products in your place too.
Yeah.
I mean, they have different things you guys can choose from, but you will recommend once they come in for a facial, like what product for them to use.
Yeah. We wanted everybody who has the potential for having a terrible Valentine's Day today to still be able to compete. So that's why we're running the special for the next 2 weeks. So.
I love that. And you guys can find everything on their website. So RestoreSDPlasticSurgery.com. You have to go see them in La Jolla. They're in UTC. Fabulous location. And then tell them, is it best just to go online or to call you, or what's the best way to see you?
Yeah, I highly recommend that you go to the website and look around and see what's available. And then absolutely give us a call. You'll talk to Erin, our coordinator, or you can submit a form submission, if you're at work and don't want to pick up the phone. And so there's a way to contact us through the website as well.
And then she's flying out because she speaks at a lot of different places. You're flying out tomorrow,
Tomorrow,
right?
I am the visiting professor for the American Society of Plastic Surgery, American Society for Plastic Surgeons this year. I'm one of them, and I'm speaking at the Northwestern Society Plastic Surgery Conference. So I'll be talking about injectable fillers and breast explantation.
And how many of those trips do you do every year?
Well, this is a 1-year gig as a visiting professor, so that's 5 trips.
Wow.
So it's busy. And I just got back from an amazing conference I co-hosted. It's the Women Plastic Surgery's annual enrichment retreat. It's amazing. So
Well, congratulations. We love watching her. She's always doing fabulous things, and she'll be a regular on the show, so you'll be seeing her more often. Well, thank you so much for all your
questions.
I know. Any questions you guys have, let us know. Consultation, you can go in and see her. Mention the Pulse for that as well. We'll field your questions, or put them on the Facebook page, and we'll get them over to Kat.
Absolutely, yes.
Well, thanks so much for being here.
All right, thanks.
Okay, guys, we're going to take a quick break. We're going to run a commercial from Kat so you can learn a little bit more about her. And when we come back, it's the ladies from North Park Observatory mixing up a cocktail that they'll be having at their Mad Hatter's Ball. So we'll see you in a minute. Thank you.
Thanks, everyone.